COPD, or chronic obstructive pulmonary disease, is a lung disease that makes it hard to breathe. COPD is a long-term disease that can often get worse over time, and it's characterized by inflammation and severe airflow limitation in and out the lungs. So when we talk about COPD, it's basically like a big umbrella. Under this umbrella, we have different breathing disorders. So most commonly is chronic bronchitis, emphysema, and asthma. What causes COPD? Smoking, as we all know, is the most common leading cause of COPD. Long-term exposure to fumes, dust, air pollution, workplace fumes, biomass exposure, such as wood smoke, can also cause COPD. There's some rare genetic disease called alpha-1 antitrypsin deficiency, can cause COPD. This is something we do screen also in the office. We do offer a free screening. Now, if you look at respiratory infections, generally speaking, flu, COVID, pneumonia, usually they don't cause COPD. However, patients with COPD can get much sicker and they can have serious complications. Therefore, it's very important to keep vaccination up to date and practice COVID safety measures. At first, COPD can cause no symptoms or even mild symptoms, so you might not know that you have it. As the disease progresses, common symptoms can include shortness of breath, wheezing, chest congestion, chest tightness with exertion, and often cough that produce lots of mucus. As the disease progresses, breathing requires more energy, and therefore it gets harder to exercise. A simple spirometry that we can perform here in the office, can help to make the diagnosis of COPD. Now, if we look at the latest GOLD classification for COPD, it's not only the degree of airflow that matters, but also they group COPD under 4 different categories, A, B, C, and D. And this will take into account not only the degree of airflow limitation, because this will tell you mild, moderate, or severe, and therefore will be able to provide you with best intervention or inhalers, to make sure that your COPD will be under good control. Now, sometime we need to do a detailed, comprehensive pulmonary function test, which we do at the hospital in the pulmonary function lab. And this is a comprehensive test that will tell us not only about the airflow, but tell us about the lung volume and also the filtering portion of the lungs, or what we call DLCO, which can also give us the more detailed information about the lung physiology and the severity of COPD as well. COPD is the 3rd leading cause of death in the United States, and COPD affects over 13.5 million Americans. Usually diagnosed in middle-aged individuals. It can affect both men and women, 40 years and older. There's no cure for COPD. What can we do? COPD can be managed by consulting with your healthcare provider early, seeking diagnosis and intervention therapy, quit smoking, lifestyle modification, eat healthy, exercise, keep up with vaccination, and most importantly, keeping up with your doctor's appointment, use the inhalers as prescribed,
Here at Holy Cross Hospital, we have a cardiac pulmonary rehab facility. In this facility, we teach our patients about their disease process. We teach them proper breathing techniques. When they come in, we would take their blood pressures, their SpO2 to check their oxygenation, their heart rate, their work of breathing, how they perceive that to be, listen to their breath sounds to make sure that there's not wheezing. We teach them how to work on their perceived shortness of breath perception so that in their daily lives, they are able to manage that on their own. So the techniques that we teach them help them to be in control of their breathing instead of their breathing controlling them.
Get diagnosed early, get treated early, because we can really make a difference, Don't wait late, Save the money on smoking and put it something else. We can help you, and stay safe. I think that's the most important thing at this point.